Welcome back, everybody. Since it is Wellness Wednesday, we've kept our health experts with us here to answer more health and wellness questions. Please welcome back Dr. Lulu Ailshi from Swedish, Dr. T from A Smiling Heart Dentistry, Dr. Angela Chen from Evergreen Health, and Tanya Owens from Primera Blue Cross. Thank you all for sticking with us. We were talking about this really interesting fecal transplant surgery. Are there risks involved in this? I didn't get a chance to ask you that during the segment.
There can be risks associated with it. First, so you want to make sure that your donor is healthy, and as I mentioned earlier, that they don't carry any undiagnosed infections. You certainly don't want your recipient getting a new infection. And then secondly, with regard to just transplantation in general and the risks associated, it would depend on the method that you're doing the transplant. So you want a provider who is providing a very careful history and physical to determine what's the safest route to go.
Right.
If you have a distended colon full of infection and inflammation, colonoscopy may not be the best way. It could distend that colon further. Perforation risks do exist, and there are different risks that can happen with upper delivery as well as even capsules.
But I presume you'd have a good long conversation about the method with your doctor. And so what does the future of this procedure look like? What are the things that you could envision in the next 5 years?
Yeah, so FMT is very exciting, as one can imagine. We really hope to identify specific gut flora so that we can possibly use the tool of FMT to further alter gut flora and control people's symptoms. So, for example, different diagnoses, especially within the autoimmune world,
like Crohn's,
like
or
Crohn's
IBS,
or
that
ulcerative colitis, even IBS or asthma, different diagnoses. Lots of societies are spending more money and time researching this to see if FMT is safe for their patients.
That would be great.
Yeah.
That would be great to be able to give people some hope. Dr. T, let's talk about sleep apnea now. If you don't hear somebody sleep, maybe it's a child and you're not near their room and you don't hear this, what might be some other signs that they have this problem?
It's a wonderful question because you can actually, by just looking at a person, sometimes tell they have sleep apnea or not. For example, if people grind their teeth, if they have a lot of wear, gum recession is another sign. At our clinic, we can do a 3D X-ray, and I didn't get a chance to talk about it, but those pictures we had, the patient developed their airway, doubled the airway volume.
Really?
But yes, you can look at the person and sometimes tell.
Lots of people grind their teeth. Does that always mean sleep apnea, or can it mean something else? And what can you do about it?
It's usually related to a smaller mouth or their muscles not being happy, which usually means the jaw is back and causing some obstructions. What can you do about it? So many people just put a night guard. But it's just preventing you from wearing your teeth. It's not addressing the root cause. In fact, there's a good movie called Root Cause. You should watch it. But
good to know.
Well, just one thing I wanted to make sure I want to say here is prevention is the best thing. From day one, parents should really look out for open mouth breathing because it's almost guaranteed they're going to have sleep apnea.
So and you can just get on it at that point.
Yeah, even if you just hold the mouth closed for an hour a day for 3 days, it actually might fix the problem.
That is amazing. Dr. Chen, let's talk about the whiteboard concept. That has actually been around, as you mentioned, for a while. What's different is the approach that we're taking with it now, correct?
Yeah, I think, if anyone's been in a hospital room recently, there's a whiteboard in every room. And it tells you what day it is, who your nurse is, and what the plan for you is. But the difference with our whiteboard is the patient gets to be part of filling out the whiteboard. And it gets updated every 2 hours as often as needed. And it's really, I look at it as patients now are going to help us write their birth story. We're not going to just create their story and they just come along with us. They're actually going to help us write the story so that at the end they really understood what happened to them.
Yeah, that seems like such a psychologically healthy way to go into this. Now, am I wrong that originally we were trying to reduce C-sections, but it's grown from there?
Yeah, you're correct. Ariadne Labs, when they started this, they worked 2 years to come up with the concepts behind teen birth. And really, the initial thought was addressing the high C-section rate in the country and how do we reduce unnecessary cesarean sections. But as we've rolled out the project, we've realized that patient experience is so much better with this form of communication. And at the end, we know that maternity outcomes are often related to communication issues, so we're really supporting better communication. But incidentally, the 2 other sites, South Shore Boston and St. Francis in Tulsa, Oklahoma, they have both seen reduction in their C-section rates. And both of us at Overlake and Evergreen have already in 2 months seen lower C-section rates than we had in
great.
2018.
And probably happier moms,
Yeah,
too, at the
happier
end of the
moms,
day,
which is the most important thing.
Very important thing. Tanya, let's talk again about preventive care. What is considered preventive care, and what are some of the extras? We talked, for example, about a blood panel. I would have thought, okay, if my doctor says this at my annual, then that's part of it. Or if he says vitamin D testing, or she, in my case, says that, then what do you do? How do you
I'm glad to be on the panel with a bunch of doctors. I was just talking to Dr. Chen about this, and it's always confusing as a consumer, right? You think you go in for your preventive visit, everything should be covered. There's actually a list of preventive services that the United States Preventive Task Force recommends, and that as a health plan, we have the 10 essential benefits, right? So typically a rule of thumb to follow is if you're in for your preventive visit and you're discussing something that's concerning and your provider is ordering something to rule out a condition or an exacerbation, that's typically going to fall out of the non-preventive realm, right?
Interesting.
Yeah.
And you can ask then and there, correct?
yeah.
In addition to the fact that we'll put a link up so people
Yes.
can read about what things are there. And does this change what is considered part of a wellness visit based on your gender or your age, for example?
It does, yeah. So along with the recommendations, it's based on your age, your gender, and your health status. So for instance, if you're a woman and you're over the age of 50, or excuse me, for anybody, that you'll get a colon cancer screening, right? And depending on your family history, you may get that sooner. Women over a certain age need a screening mammogram. Same with men for prostate cancer screening. So it varies. And for child wellness visits, there's also immunizations that are recommended from the CDC. So it really does fluctuate based on your age, your gender, and your health status.
Right. Well, I'm so glad there are places we can check so we can know before we go, and we don't have to have these strange questions that are unanswered because we didn't know who to ask, or we get a bill that we weren't expecting to get. Thank you all very much for being with us today. We'll have more New Day right after this break.